Eating disorders aren't talked about. If you think about 100,000 kids and adolescents, out of those 100,000 kids, 120 have Down syndrome, 56 have sudden infant death syndrome, 15 will develop cancer, 12 will develop type 2 diabetes, and 2,900 will develop an eating disorder. That's 2,900 kids and adolescents out of 100,000 that are struggling with an eating disorder. Eating disorders also co-occur with things like suicide, addiction, opioid drug use, and we prioritize things like suicide and opioid use. But if you have an eating disorder, you're 4 to 5 times more likely to have these other sorts of problems. So while we're talking about suicide and opioid use, we're not talking about eating disorders, even though they are affecting as many individuals and causing as much suffering, pain, and cost as these other illnesses that we commonly talk about.
What are some of the biggest challenges of treating eating disorders in Kentucky?
I think the biggest challenge is access to care. And that looks a whole lot of different ways. So first, there's no partial hospital or residential program in the state, which means that people who are really sick and really struggling from eating disorders, we have to send to St. Louis, which is the nearest place that can treat people who need that intense level of care. The other big problem is that most medical and health professionals and mental health care providers in the state have no training in eating disorders. So they don't recognize eating disorders when they come in to places like pediatricians or primary care. And so you have folks who come to you after having an eating disorder for 10 to 15 years because they've been going to medical professionals that the eating disorder has just flown under the radar.
What led you to open the Louisville Center for Eating Disorders?
I moved back to Louisville after finishing my PhD and became faculty at the University of Louisville in the Department of Psychology. And I was doing research, developing new treatments for eating disorders. And within the first couple months that I was back in Louisville, I started receiving calls from all over the state. From families and people with eating disorders asking me where they could go to get treatment. However, there was nowhere for them to go in the state of Kentucky. So I started seeing a few patients myself, but realized that me seeing 2 or 3 people a week just could not even nearly fill the need in the state. So then in October of 2017, I founded the Louisville Center for Eating Disorders to be able to help see and treat all of these individuals throughout the state who need treatment for eating disorders. In December, we'll be going to Kentucky Congress to ask for funding for a Kentucky Eating Disorder Coalition. This coalition will be charged with increasing access to treatment and to better treatment across the state of Kentucky. And we'll do this by working with organizations across the nation that provide trainings, education, and prevention services for eating disorders. So what we would like to do is to be able to go in to existing facilities, hospitals, schools, communities, and train people who work with at-risk youth, adolescents, and adults to detect eating disorders, to prevent eating disorders, and to be able to better treat eating disorders.